One time for everybody checking in. This is Nightcap Knowledge. We'll be getting started in just a few moments. We've got a great show lined up for you tonight. We've got Dr. Fred Smith, mental health professional, licensed. I ain't talking about driver's license. I'm talking about some real license. Got to put some work in for these licenses. I'm talking about this like CDL, but for your brain. For your mental health professional, Dr. Fred Smith on the show tonight. This episode is brought to you by Mississippi's Greatest Weekend. That's MSGW, HBCUs, D9 Culture and Music, May 26th through the 29th on the Mississippi Gulf Coast. That's Memorial Day weekend. We've got all sorts of activities. You can get a weekend pass. You see what it is right there? We got the events, the mix and mingle, the comedy show with Rita Brent, ladies and gentlemen, the adult field day for the 990 to 2000 party, and then we've got the R&B day party. One time for everybody checking in, Nightcap Knowledge will begin now.
Get it.
You know when you're a rapper and you about to go out, you be like them boys on LA Leakers. Mac has no idea what I'm talking about.
I don't. I'm just going with the flow, man. I like the beat. You know what I'm saying? Also, that's that funk face them drummers have. You know, them drummers have that face. There it is. Hey, who got one of the best funk faces? That's a drummer?
Yeah, who? Who, man?
Your boy.
Who, man?
Tim.
Oh yeah. Tim boy. In the pocket.
Hey, if you watch what is that? James Brown?
Yeah.
When he was playing them drums?
Yeah.
And he was looking at the look, he was just.
Hey, you know somebody that has, or I haven't paid enough attention to him to see if he has a funk face.
Who's that? I have never seen it. He just before he get into it, he'll pick that hair.
Yeah.
And that's it.
Yeah. Yeah, man. And Questlove cold.
Sheila, he doesn't.
Yeah. She just has a
She be like,
just a glow.
but she's smiling and be like, how are you smiling the way you play it? Right.
Yeah, man. Yeah. Hey, man. Look, glad to have you here. My name is DJ George Chuck. That's Mr. Mac. Mac, give him the disclaimer, bro.
This show is rated black and uncensored. Real talk, real issues, real solutions. Just letting you know, if you want politically correct, this might not be the shit for you.
This might not be the place for you.
There it is. There it T, and we're gonna tell it like it T-I is. We try to make sure we specialize and talk about things that are very relevant to our community. We're gonna highlight some things, and we're gonna dive into the show a very, very strong topic that affects everything, because your mental can affect your medical, and your medical can affect your mental. And I can break that down a little bit more after we give our mental health minute, and we're gonna dive into the show.
Yeah. Man, you go ahead and give me that mental health minute, and by now your kids should be in bed.
Hey, but if not, you know how we grew up. I can't remember. It's a lot of artists that shows like when they was little, and they was staying up past their bedtime and seeing what their parent were doing.
Yeah,
and like now you saw it. That's what you got. You got what you were looking for. You saw some shit you shouldn't have saw.
You got exactly what you were looking for.
That's what you get. You're looking for. You saw some shit you shouldn't have saw. All right. So the mental health minute for tonight is crisis. What to do within a crisis. So during a crisis, your focus is to deal with the situation, gather accurate information, and communicate quickly. Bring the situation under control. Before you do anything, ensure safety or well-being of everyone involved. Also, protect people first, property second.
Yeah.
Needs over wants. People first, property second.
Yeah, man.
So that's speaking to a larger crisis. If something happens, a tornado, a hurricane, fire, explosion, people first, property second. Now, for us, being the hue that we are, we have known in situations, especially like in Hurricane Katrina in New Orleans, where before they did anything, you had folks on the upper echelon was making sure that after the storm is over, nobody that didn't look like them could get the land or get the property.
Yeah.
But you just said, who should you make sure you take care of first? In small towns like where I was from, even though the white community did not have as much damage as the black community when our neighborhood flooded in '97, they wanted to make sure that the white community houses was taken care of while we had senior citizens waiting in water. So people first, property second. Also, crisis does not have to be a major catastrophe. Your crisis can be your own personal situation where something happens directly to you and only you.
Yeah.
And that's when you really want to focus in on managing your emotions, thinking about safety of yourself and what you need to do and what's important, but also identifying that checkpoint for yourself. Because you can have a own personal crisis. It can be for something traumatic, like say you losing your house, or you running out of gas. That could be a whole crisis in the situation, depending on where you are. When we travel, we make sure that never let the car get below half a tank. Why? Because I've been in that line going to Texas, and you out there for 2 hours on the highway. That's a whole crisis, So crisis can go from small to large, but it goes back to managing your emotions so that you can think clearly to address the situation at hand. And be able to respond to make sure that every life, including yours, is protected and well guarded.
Yeah. That's the mental health minute, ladies and gentlemen. Mr. Mac, it made me think about piss poor preparation promotes piss poor performance, and piss poor performance promotes pain. So if your ass ain't prepared, for any particular situation, look, you might not be capable in that moment, but the fight or flight thing comes into play. And I know we're gonna dive into mental health, and I think preparation is one of those things that that you can do to try to maintain healthy reactions in particular situations. But look, before we do that, Mac, I saw you went with the wine tonight.
I did.
Did you have and typically on Nightcap Knowledge, for those of you that are tuning in, we thank y'all for tuning in. Shout out to all our folks over on the Nightcap Knowledge page. You're officially a Nightcapper. Shout out to our folks over on the Black with No Chaser page, and to all my Twitches out there. What's up, Twitches? We appreciate y'all for checking in with us and rolling with us tonight. Now, what type of red you drinking, man?
So, you know, I don't just like a very dry. I wouldn't do a cab or Merlot. I like a blend. So this is Apothic Inferno. I think I've had it, and it's, you know, aged in a whiskey barrel. That might be one of the reasons I like it. But it's definitely it definitely got to be one of the reasons. But it's a nice. It got some bite to it. But it has a smoothness. I like it cold. This is one of the ones you can drink cold. But it's a good wine. You know, it's a really good blend. I also have here. I have one of the 19 Crimes, who's also a red blend. So this is a pretty good one right here. I haven't got into that one yet. That one I keep at room temperature. But so I've shout out to Chill Will, the captain over there, shares Chicken Coop. He the one that introduced me. I was getting some wine. He said, "Man, I like them right there. You gotta be careful with that." Because I did the Inferno Red. I said, I tried the red. I like the red. So be careful with that. I mean, Apothic Red. Be careful with that Inferno.
Yeah,
man. I started drinking that Inferno. That's my go-to red.
That's your go-to red.
That's my go-to. Man. That's my go-to. What you got over there?
I have just a small pour of Grand Marnier. Just
well defined. You know what? Sound like you went to Tougaloo, sir.
Hey, look! Shout out to all the Tougaloo folks in the comments. I'm seeing a lot of folks that we know.
Well, my special shirt. I wore the official Tougaloo shirt. Got the seal on everything.
Seal. You know they don't sell those anymore.
Hey, listen! Shout out to Mr. Tougaloo, Timmy Bridgman.
Yeah.
He got this shirt.
Yeah.
He got this shirt for me. He's a good
I got a special surprise for you, man. We're gonna tease part of our show next week before we bring on our guest for tonight. I have and I'm not gonna call her by her brand name. I'm going to allow her to introduce her brand name, but I know her as Markeisha from back at Tougaloo. Next week we'll have Markeisha, also known as Fam Bam Shay. We're gonna bring her on, and she's going to be on the show next week. So let's give some applause. Let me get the applause ready, y'all.
Get your applause ready.
Yeah. Let's get Markeisha on here.
Come on, Tougaloo.
Yeah. What's up, everybody? Well, since y'all didn't ask me what I'm sipping on, I'm actually sipping on some coconut water.
I love it.
Yes. Health is wealth. Okay, so we're bringing it full circle, right? With the fitness. I'm loving the topic for tonight with mental health. And so just to plug coconut water, like I live by it. You know, it is just a great mood booster and also proven to reduce anxiety. So tap into this coconut water. It's good stuff, y'all. So yes, as Chuck said, I am Markeisha Newsom, also known as Fam Bam Shay. I am so excited. Thank you so much for inviting me on the show tonight. And I cannot wait to be a part of next week's panel discussion. But I am one of Tougaloo's own, class of 08.
Look at
yes. Class of 08. I am currently in the runnings for the Miss Health and Fitness 2022, and also competing for the cover of Muscle and Fitness magazine. So I am here just letting you all know that I have advanced to the next round. I'm currently in the top 15, and we have 2 more days left to make it to the next cut. So I am really just asking for your support because there is just a real need to representation matters. And it is just a real need to represent the culture well. And I feel that, you know, I can definitely do that. And I'm ready to represent and also just be a resource, a continued resource to my people. So I want all of my people to be wealthy, because health is wealth. You can have all the money in the world, but if you do not have your mobility, if you do not have your mental health, your physical health, all of those things go together for the greater good of society. Because when you think positive, positivity brings positivity. So we're all positive vibes only. Thank you again. Just wanted to kind of plug that, and y'all tap into this coconut water. It's really good stuff. Yes.
Shay, before you go, I need you to make sure that you in the comments for tonight's broadcast put the link.
Absolutely.
Or either, you know, plug your profile, and then they can go to your profile and get that link so that we can have a voting party while we're doing the discussion tonight.
So dope. I will most definitely do that. And then for those of you who do not know me, I'm on Facebook as Shay Newsom, and my link is also in bio, but I'll definitely get that information in. Thank you guys so much. See y'all next week.
See you next week.
All right.
All right.
All right, everybody out there, get ready to share, tap in.
I say share that.
Yes, like, everybody share. Miss Shade, tap some of your friends, tell them to tune in. We want to make sure it's Tougaloo strong, Tougaloo supported. So we're going to make sure everybody supports. So everybody share. Right now, it's the time for a very, very serious topic. I'm looking for my brother, Cliff Jeffrey, because he asked about this topic a while back, which is brain drain. Okay, he out there. All right, yeah, because I hit him up earlier to remind him because he's in a different time. So, but yeah, I want everybody to pay attention, man, because this is something that we need to talk about. And like you said, health is wealth. And whether you're talking about your physical, mental, or your spiritual health is wealth. So let's bring him out, Chuck. Introduce him.
Hey, look.
Introducing him like he need to be introduced.
He gonna sound like he a Baptist preacher.
Well,
and he has it in his background. Like the man came up in church, but he's one of those brothers, man, that is as he walks, he talks. I'm talking about none other. We talking about Mr. Dr. Frederick A. Smith, ladies and gentlemen. Y'all give it up for him. Give it up for him. There you go. Let's get him in the top corner.
You heard looking just like himself.
Mr. Doctor.
How's everybody doing?
Man, good, man. How you doing?
Doing great. Thank you so much for having me on. I really appreciate this opportunity.
Man, appreciate you, man. You know, in protocol, we call him Brother Doctor. Brother Brother.
Yeah,
Doctor Brother.
And we definitely gotta give Fred some cred. Fred is also a member of the illustrious Omega Psi Phi fraternity, where friendship is essential to the soul. And
to the good bros.
Yeah, root to the bros.
We ain't gonna hold that against you, Fred. You were doing good for a minute.
Hold on. Hey, Fred, you ain't gotta worry about that. I got your haters, dog.
Okay.
Look, I kick his butt out anytime I get ready. You know, Ziggler want to start hating, he will get kicked out of the live. So if you want to come, I'm gonna add you back, Mac. I'm gonna add you back. Now, if you come with some more, we ain't gonna hold nothing against you. I'm gonna hold this button against you. How about
that? You might well keep my ass off because I'm going in all night. I don't care. No, we definitely. Hey man, listen. I think Tougaloo, Beta Roll, PE been giving each other a hard time for a long time. But as we learned in freelance one night, say what you want to say.
Hey, we're gonna stick together. Tougaloo gonna stick together, but
not put your hands on them. Don't put your hands on them. Don't put your hands on them.
Yeah, man. Hey, look, Fred, let's dive into this conversation, man. I know we've had some of our nightcappers that have requested certain topics. I think this week is particularly a good one. Not only is it Mental Health Awareness Month, we've had another one of these mass shootings. But we also are faced with the situation of brain drain in Mississippi, where you're a professional and where you have to leave. And we want to talk about a variety of those topics. So I know, Fred, you got an intro or something prepared where you're going to introduce yourself, give a bit of your background, but just let everybody out there know some of the things that we're going to tackle tonight. And it's going to be real conversational, but we want this to be beneficial for you. So if you got questions and comments, please put those out there, and we're gonna try to get everybody plugged in and everything. So Fred, go ahead, introduce yourself. Dr. Fred A. Smith, everybody.
Give him the big screen, Chuck.
So I'm Dr. Frederick Smith. I am a licensed clinical psychologist. I of course, proud alumnus of the illustrious Tougaloo College. Graduated in 2006 with a bachelor's degree in psychology, and then I went on to receive a master's degree in clinical psychology as well as a doctorate degree in clinical psychology from the Chicago School of Professional Psychology in Chicago, Illinois. Then I also have a specialty where I had also did a specialty in forensic psychology. So I did a postdoctoral fellowship in forensic psychology, and I did that work for a few years, down in Georgia before returning to Chicago. And I currently am a psychologist with a company called Life Stands Health, where I provide, therapy and psychological testing and evaluation, and as well as consultation to those that are seeking mental health treatment in the community, of course, community mental health. And I've worked in various settings: prisons, schools, college counseling, general medical facilities with psychiatric units attached, as well as state-run inpatient psychiatric facilities. So a number of different settings that I've worked in, and worked with all ages, from children as young as 6 years old all the way to adults 96 years old. Really love the work that I do.
Man, Mac, you're a mental health professional. Your wife is also a mental health professional. I'm interested to get your first comment or question to get the conversation started for mental health awareness tonight. So, Mac, what has been one of the things, because Mac does his mental health minute every week. What's one of the things that's heavy on your mind, man?
I guess he just explained the different variations of mental health and treatment. And he said community mental health. So community mental health, a lot of times, I guess, folks understanding this, for us here, it'd be like Heinz behavior health. You have where people come in and it's really not, it explains that you're dealing with the average person. You know what I'm saying? That the people that a lot of times they don't have the best top of the line, insurance, but they have the greatest need. A lot of times they are stricken socioeconomically. They don't have the money, they don't have the status, and a lot of times when it comes to folks that don't look like us doing the diagnosis, a poor Black man that has a blue collar job will have exemplified the same behaviors as a white man with a white collar job. One gets diagnosed with anxiety, one gets diagnosed with schizophrenia. And we've seen that. What are some of the things have you seen in working multiple places when it comes to discrimination, when it deals with Black, but especially poor Black? I've seen it firsthand, and how when somebody with some money and status come in, everybody want to run and try to clean up stuff and make sure it's 10-10. So.
Well, I think the first thing we need to look at is, just the stigma surrounding mental illness, where stigma, refers to discrediting, devaluing, and shaming a person because, of characteristics. And that's just a blanket description, but because of characteristics or attributes that they possess. And so when it comes to mental illness, you have multiple dimensions of it. You have self-stigma, you have public stigma, you have professional stigma, and then you even have institutional stigma. And so public stigma refers to negative attitudes towards those with mental illnesses held by the general public. So that's stigma, is that discrimination or those biases that the general public has towards those that have been diagnosed with mental illnesses. And then you have professional stigmas, and that refers to healthcare professionals where they hold stigmatized views and attitudes toward their patients, and then you could have self-stigma, where and self-stigma is related to attitudes and beliefs that a person that has mental illness, attitudes and beliefs that they perceive are being geared toward them as a person, with mental health diagnosis, if those make sense.
Yeah, that makes me think about how I guess I want to say why it's so difficult for our community to seek mental health care. And like self stigma, like, is one thing for us to be on the receiving end of stigma as it relates to healthcare, period. Right? We know that maternal health in terms of Black women, they're more likely to die in childbirth than other folks. I from the way I'm looking at it, everybody trying to push the baby out, or something happens where the care is not the same. But the flip side of it is, why is it so hard for us to say, like, man, I might need to go talk to somebody, or I need to seek professional care? And then that self stigma, like, where are we getting that from? Is that taught? Is it in our DNA now? Like, where do you think we're getting that from?
Well, I would say, it's a part of it is taught. I remember, just growing up and things that people say, especially in our culture. Of course, in our culture, I remember growing up and, people making statements about, people with mental illnesses, oh, they are crazy, or a person with a mental illness, they'll try to hurt you. You need to stay away from that person because something is wrong. And all of these myths and negative connotations, that people have towards people that have mental health disorders. People with mental illness are so violent. And that's not even true. There's no research that shows that people that have mental health problems are more likely to be violent than the general public, because there are many people out there being violent in the general public that have no psychiatric diagnosis.
Exactly. Like, what do you attribute to the lady and the man down the street? They always going at it.
Yeah.
That's violent.
And that thing, what you just said, what attributes to that is you force them into it. I mean, you target them, you pick on them. It's like you create the monster that you're looking for because of what you do to them. Our society, those who we say have intellectual disabilities, people talk to them differently. It's like you are taught to talk to them in a condescending tone, in a different way. You treat them different. So when people react differently, and then you're like, oh, see, but you provoked it. You created the situation. I've seen it on many occasions. I've seen it on a trauma unit with a gentleman had head trauma, and I saw the nurse talking down to him. He said, "You don't have to talk to me like that. I'm a person."
Absolutely.
Well, she got in her feelings because she was in front of her other friends. And she called security on him and said he was being aggressive. And he was just asking for the doctor so he can get some meds. So, what he said, a lot of the self-stigma comes from public. It's what the public put into your head, environment growing up, put into your head about that person that really just needs help. And a lot of times they don't get the help because go ahead, Fred.
Oh, no, I was just going to say, and then just think with all of the lack of understanding for mental health disorders. So if I don't understand something,
right,
rather than me gaining knowledge about it, I shun it, or I shy away from it, or I act as if it doesn't exist, or I make negative remarks about it because I don't understand it.
Let me ask you this question, and just full disclosure, Fred and I talked a little bit this morning. I was headed to go drop off some dirt for some folk, because that's what country boys do. We go drop off dirt and seeds and stuff. But Fred and I were talking about how prepared, and we getting back to we talked about 12 P's, but in preparation, how can you prepare as a family, or as a college student, or as a college administrator, to be able to identify, or at least be able to say, all right, well, look, I'm seeing some signs of mental illness. I think we may need to make some sort of referral. Like, is there training for that for like families and college students, or things that we can do in our community to where we can feel prepared as community members to kind of spring into action if we see something like this happening? Because I like for you to share the story of your encounter on, I think you said subway in Chicago, right? You getting on the train. So talk to us about that preparation that we can do, and then share that story if you can.
Check out Cliff's comment too, Chuck.
So preparation, involves, of course, gaining knowledge about, these different disorders, because mental illness is not going anywhere. It will always be with us, just like physical illnesses.
Right.
There is no difference in having a physical illness and having a mental illness, where a congestive heart failure might affect the heart, schizophrenia affects the brain. And isn't the brain a bodily organ?
Yeah, you better believe it.
And see, the brain not only controls your breathing and your heartbeat, but it also controls how you think,
Yeah,
your emotions, how
Yeah.
you perceive, how you respond, and how you react. And so if the brain is sick and is not able to regulate these different areas, then you're going to see different behaviors. You're going to see abnormalities in a person's thinking and in a person's perception and in a person's emotions, because these are the things that the brain control. And when mental illnesses, set in, those areas are the ones that are affected. And that's why you see these different behaviors that may look a little abnormal to just the average person. So, expanding awareness, understanding, that this is what it looks like. And maybe we should try to put some things in place, such as expanding, access to mental health care, and having programs and having people such as mental health providers in place on the college campus and out in the community, and even people getting involved with NAMI, which is the National Alliance on Mental Illness, because NAMI provides community meetings, support group services, training, and educational materials for individuals and families that are battling mental illnesses.
That's it, man. Mac, jump in there, and then want to get to Cliff's comment.
And that's what for me, I use the term behavioral health education, about helping people understand that every behavior that you see is designed to meet a need, and understanding that, like you just said, we have mental health first aid, we have different things where people can learn how to be in a better citizen, a better family member, a better whatever, by understanding, breaking this stuff down. It's there. We got smart dumb phones. You can find whatever you want to find by Googling it. But what you just said is very, very important. We have to teach ourselves to understand that everybody is not the same. We are different. And one of the major things I want to say is you treat the person, not the diagnosis. Everybody is not the diagnosis.
Absolutely. You want to give person the same dignity and respect that you would want yourself, because see, mental illness can strike anybody. Right. Anybody. There's no respect of person. Absolutely. And just because, because schizophrenia, bipolar disorder, major depression, they typically affect men, starting in their late teens and early 20s, and women, typically a little bit later. But just because I may have gotten past the age that I could, typically be diagnosed with those disorders, doesn't mean that I couldn't develop dementia in my later years. So it can happen to anybody, absolutely anybody. There's no respect of person.
So look, man, we got a comment from Tougaloo Clifton Jeffrey. Yeah, he's got a couple of them. One of the comments says, I think it's a community ignorance that we all associate or we associate all aspects of behavior that goes against community norms as a mental illness. So we overly label people who commit bad acts as having mental illness with no diagnosis. So we web MDing and diagnosing folk with stuff that they don't necessarily have. Thus, the general public then assumes and associates with that. It's the same as the black people on welfare narrative. That's all they show and label. So people incorrectly believe it, when the truth is many people with diagnosed mental illness are living functional.
Absolutely.
Yeah, that's real.
Absolutely.
Well, Cliff has a question. Well, what do the mental health resources look like in Central Mississippi for people below the poverty line? And I guess we can generalize that to areas where large populations of Black folk get together and stay and live and attempt to thrive. So, Fred, you want? I mean, Chicago is like North Mississippi, in my opinion. Fred, like, nah, we got a couple more things up here.
Hey, they got some. Listen, Chicago got Mississippi roots, and Mississippi got Chicago roots.
Absolutely.
Yeah. So let's try to talk about. I mean, like, what do mental health resources really look like in our communities? Like, do we have these like, do we have Freds at the neighborhood clinic?
Well, the first question is, do you have a neighborhood clinic?
Right.
That's the first question.
Yeah.
Right.
In a lot of rural areas, you really don't.
You don't.
Yeah.
And so then there's lack of access to consistent care.
Yeah.
Yeah.
Now I can give an example of and Mac, you know these folks, the Aaron E. Henry Health Center, because we've done work with them. They've attempted to, and I can say they've done well in terms of being a good steward of their resources, in expanding their imprint into the rural areas of I would say everything above central Mississippi. But then what's the clinic? The Jackson Hines Comprehensive Health centers. Those are, I don't know how many of them there are, but Matt can speak more to that. But in terms of the Delta, I think Aaron E. Henry and it's a couple more places that, you know, they're sparsely laid out, and they have vans and buses where they'll go and get people and bring them to the clinic, and they got the mobile clinic. So we ain't got the neighborhood joints, but you know, there are some people out there trying to do it.
But see, now one thing that I did, applaud a lot of, insurance companies and insurance providers, is that when the pandemic hit, they expanded access by offering to pay for telehealth services.
Okay.
And so a lot of clients that were coming to me, that I was seeing over the telehealth platform, they lived in, downstate Illinois, which is similar to, rural areas, a lot of, maybe some, a few large towns here and there, but it's pretty much a very rural area. And so I was having clients from, a real rural area in Southern Illinois that was seeing me for therapy over the telehealth platform.
Yeah.
And then also, even having their psychiatry appointments with the psychiatrist or the nurse practitioner over the telehealth platform. But because, and it was the pandemic that kind of opened the door for that. Right. But what I'm seeing now is that because, the numbers are going down, a lot of insurance companies are now removing that aspect where they're saying we're not going to pay for telehealth services anymore.
Correct.
And so now you have people that were benefiting from that service not being able to benefit from it.
Yeah. That was something another Tulu alum, Dr. Berthon Mak Muhammad, cardiologist, when I came to the clinic with him, the goal was to create that nest, because we educated people what affects the heart for causing heart attack and stroke, where it's more than just your diet, stress levels, activity. So I was working with them, we were referring them, and we have been fighting for a long time to get telehealth put in place, because we had folks that would get on a van in the Delta and ride 2.5 hours to get to Jackson to see a specialist. And we were saying, like, you can go to the local clinic, set up in a room and see the TV and camera and talk to your specialist right there. And it has saved you a drive versus, and older people, they think every time they go to the doctor, they're getting blood work. So what do? They get on the van, I'm for real. They get on the bus or the van and don't eat. So they sitting there at 2:00 in the evening. You're like, what's wrong with you? They ain't ate all day. And they've been up since 5:00 in the morning.
Yep.
And now they got it. And then they got to sit there and wait till somebody come back and get them after they drop everybody else off.
Yep.
So telehealth was definitely something that we needed, and that was greatly utilized in rural areas like Mississippi. Absolutely. And in other areas where you can log on and actually talk to that person. And that person could give you more time and attention than they probably could if you actually came into the office and saw them. So
absolutely.
So, Fred, was another thing that was asked. So
look, Mac, while you going for that, we definitely want to remind folks that Markeisha is in the comments right now. If you haven't vote it, go ahead and do that tonight before you go to bed. We're going to continue the conversation, but we definitely want to remind people that we want to support our Tougaloo alum, our Tougaloo family. Markeisha Newsom, Fam Bam Shay, she's got the link in the comment. And Mac, I hope you found that comment.
Yeah. So we were saying about people in the community that commit crimes, and that that are not diagnosed. I have a different narrative. There are a lot of people out there that exemplify behaviors of having some type of behavioral health, emotional disturbance, or mental illness. They are not diagnosed because they don't go, or they get misdiagnosed. And I've heard this happen, especially with children. They just acting like this baby got anxiety. They just acting. Ain't no wrong with them. They having a panic attack. They just acting a fool. That child is having a panic attack. They about to have an asthma attack. They can't breathe. They just acting. Right. So this child actually has been crying out for help. But because of the stigma and stereotype of age and not knowing, you look over it and say, or then you have somebody that have ADD and they act like they have, like you said, bipolar schizophrenia. They say crazy. He has ADD.
Right.
So it's like one extreme to the other, but you hurt the person that's diagnosed by your ignorance of this whole situation.
Right. And then furthermore, I mean, and you made a good point, Mac, when you were saying about, the child is just acting. Well, here's my take on that. Children are often not able to verbalize how they are feeling. So they act out. That is their way of crying out for help. And and let's not forget about trauma, complex trauma that a lot of children and adults experience. Physical trauma, mental abuse, emotional abuse, sexual abuse, that children often experience.
Yeah.
And they're not able to verbalize that experience. They're not able to verbalize those feelings. And so they act out because they're crying out for help. And this is the only way I'm hurting inside. And this is the only way that I can show that I'm hurting, because I don't know how to tell somebody that I'm hurting. Because of course, in our community, what happens in this house stays in this house. Or what happens in this family, you don't want to tell your business to anybody. And that's another reason why a lot of people won't seek out mental health treatment, because we shouldn't be telling our business to other people. We need to present as strong.
Right.
We don't need to show any type of weakness. And so, and why is it that I need to bring somebody else in to help me resolve my problems? I should be intelligent enough and be strong enough to resolve it on my own. And those are a lot of the things that are taught to us. But see, if you had a heart attack and you needed to have open heart surgery, would you do surgery on yourself? Or would you go to a physician and or to a cardiologist and have him to perform the surgery?
And what I look like at the house, like,
right.
That makes no sense.
Right.
And I know I'm making light of the situation, but there's no way. And this is one of my picker tools, and it was just appropriately here. But you're not gonna do that. You're not gonna do that. So why don't we have? Or I guess the question is what do we need to do to add some sort of or some level of training for school teachers or daycare workers? And I know we've had conversations around, and this may steer this conversation in another direction. I think Shahar, Dr. Tova, mentioned this earlier with the domestic terrorists. We talk about it with police officers in terms of mental health training, crisis response training.
Absolutely.
But I don't think we talk about the kids, college students. I didn't get, when I was over student activities, I didn't get any mental health training as a part of my onboarding. So I think one of the larger conversations that we need to have is How do we make mental health training a part of onboarding as it relates to human resources and, you know, employee development?
Well, see, I believe that should be a part of your new employee orientation, especially if you work in a sector that deals with or has dealings with the general public.
Yeah.
You know, school administrators, teachers, college professors, the police department. You're working with the general public, and so you're going to at some point encounter somebody that has a mental health disorder.
Yeah.
Tell you a little story. I was going back to what
Fred.
earlier. You had I had maybe around the fall of 2019. I was coming home from work, and I got on the Pink Line train in Chicago, and there was this African American guy. He looked to be about maybe 24, 25 years old.
Yeah.
And he was having a conversation with himself. And it was a pretty aggressive conversation, you know, to the point where, you know, he wasn't really targeting anybody in particular, but he was yelling at someone that was not there, pretty much. And of course, I immediately recognized what was going on.
Yeah.
Immediately, I knew that he was obviously, you know, in the midst of a psychotic episode. And so when the train got there, we stand out on the platform. And of course, I got on my train, and then he got on the same car that I got on.
Yeah.
And he started, you know, making these statements saying that, you know, people were trying to hurt him and people were trying to do things to him. And then he was kind of like, you know, yelling and getting a little bit animated, but he wasn't really targeting any person in particular, because the people that he was talking to didn't exist.
Right.
He was responding to auditory and visual hallucinations. Okay. And so, but of course, you know, I'm standing there, I'm looking around on the train, and I see that a lot of the passengers are getting very uncomfortable. You know, they're moving away from him. They're, you know, clutching their purses and moving to, you know, to areas in the train that are, and it's a pretty, it's kind of packed, you know, because it's rush hour when people are trying to get home.
Yeah.
So we went maybe about 4 or 5 stops, and one of the other passengers got off the train and went and got the train conductor. And so the train conductor comes, of course, to remove this guy from the train, or, you know, I guess reprimand him, whatever he had planned to do. And when the train conductor got on the train, I stepped up and I stopped the train. I said, "Wait a minute, sir. I'm Dr. Frederick Smith. I'm a licensed clinical psychologist. I know what you're here for, but that man he's in the middle of a psychiatric episode. He hasn't hurt anybody. Of course, some of his behaviors might have spooked some of the passengers, but he's not hurting anybody."
Yeah.
So the train conductor said, "Oh, thank you so much for telling me that. I really appreciate it." And he turned around and started driving the train again. And maybe a stop or two later, the guy got off the train. He didn't hurt anybody. He was just in the middle of a psychiatric episode. But I shudder to think what could have happened had the police been called, and had he been having like this aggressive conversation with the hallucinations,
right,
not responding to the police directions to put your hands up and things like that.
Yeah.
You know, so I shudder to think what could have happened if I had not intervened.
Comply.
Right. On that train, I'm the only one that recognized. It had to be about 40 or 50 people on the train that night.
And you in Chicago.
Right. And I'm the only one that recognized that he was having a mental health episode.
It just really, all these folks are, I guess my thing, I always have an issue with subpar professionals who people take advice from, who are not called to be in certain line of work, and how they respond make the situation worse. Why do people believe that folks that have mental health issues or mental illness are violent? Because you approach them in a manner and in a situation or in a time when you should not. And the worst thing that most of them do
Escalate.
They touch them,
Mm-hmm.
and it escalate from there, and then they got violent. What did
Right.
they do? They started fighting me. But what you did not tell them, that person was just talking. That person was just moving away from you, and they want to be. And you did not recognize, because you get into a territorial mindset of, I'm going to make you do something. You know, and then because we ain't picking the cream off the top of the barrel a lot of these positions. I'm just gonna put it out there. I tell it like a TIE is, you ain't got to say that, Fred. But we ain't scooping the cream off the top of the barrel when we get with a lot of these situations. So comprehending and understanding someone that is suffering and having a real break, or exemplifying some type of psychosis, because again, when we talk about your medical can affect your mental, and your mental can affect your medical, let your sodium be off.
Right.
Let your sugar level be off.
Absolutely.
Blood pressure. For Black people, they always ready to diagnose you with something when your levels are off. And the first thing they do is go to a psychotic diagnosis versus a psychiatric diagnosis, saying this person having a psychotic break, versus saying, let's check all the numbers to see what they look like.
Absolutely.
Yeah.
There should always be a rule out of medical before you look at psychiatric, because the DSM, which is what we use to diagnose, says that, of course, whatever symptoms you have to look at, are they being caused by a substance such as a drug or a medical condition? You have to look at those areas first, because even using certain substances, heroin or cocaine, can cause psychiatric symptoms. General medical conditions can cause psychiatric symptoms. I just did an evaluation with a young man last year, and I gave him a diagnosis of bipolar disorder due to head trauma. He had he hit his head in his basement, and then he started having symptoms of mania and depression. And so it was the head trauma that caused the bipolar disorder, if that makes sense.
Yeah. Older people, UTI.
Absolutely.
Urinary tract infection. They ready to say, oh, we need to get some type of, no, UTI. Once the infection clear up, their mental state goes back.
Absolutely.
So Fred, real quick before we go, I want you to do a couple things. Outline some of the common diagnoses, certain behavior patterns, and what some things that people you would recommend based on that. I learned years ago that two major things that we take for granted. Sugar is the biggest drug in the world. Anxiety is the biggest mental health disorder, because pretty much everyone has some form of anxiety to a certain level. So if you could just kind of give folks some understanding, the idea with, and some things for them to think about and look at.
Yeah. Well, and I'm glad you mentioned anxiety, because when you mention anxiety, I think about generalized anxiety disorder. And generalized anxiety disorder is the most common disorder that people are diagnosed with and that people seek treatment for. And so, of course, it's normal to feel anxious from time to time, especially if you have a lot of stressors in your life. But excessive ongoing anxiety and worry that are difficult to control and interfere with day-to-day activities may be a sign of generalized anxiety disorder. And I just want to just kind of back up really quickly, just to kind of go back to something that you said earlier about people trying to self-diagnose. With different psychiatric diagnoses, the symptoms some symptoms are different, and a lot of the symptoms overlap. But the one criteria that all mental health disorders share is that it must cause significant impairment in social, occupational, academic, or other important areas of functioning. And so I might have symptoms that may align with generalized anxiety disorder or major depression or schizophrenia. But if they're not causing impairment in those important areas, such as my ability to do my work, my ability to, interact with my family members or my friends or my spouse or my children, or my ability to do my daily chores, my ability to engage in my leisure activities or social activities, if my symptoms are not interfering with those specific important areas, then it's not a diagnosis. It's not a diagnosis. It has to cause significant impairment. If I am so depressed that I cannot get up and go to work, then it's probably major depression. But if I'm feeling sad, but I'm still able to function with no issues and it's not causing any impairment, then it's not major depression, if that makes sense.
Yeah, that make a heap of sense to me. I'm glad you broke that down like that, man, because I think we got to get away from, attempting to self-diagnose.
Right.
Something that we honestly have no baseline understanding of.
Mm-hmm. And at one point, we all might experience symptoms related to these diagnoses.
Right.
But that doesn't mean you have the diagnosis. I could hear voices all day, but that doesn't necessarily mean I have schizophrenia, especially if it's not causing clinically significant impairment in social, academic, occupational, or other important areas of functioning.
Yeah.
If it's not impacting that, then it's not schizophrenia. And a lot of people hear voices, have hallucinations at one time or another in their lifetime. Have you ever, felt something crawling on you and you look down and there's nothing?
Shit, I just did that a few minutes ago.
That's a tactile hallucination. That doesn't mean that you have a mental health problem.
Yeah, I don't know if it was a fly, if it was a hallucination, but I damn sure looked down there. I was like, man, hold on.
Right.
Yeah.
So those things are just normal occurrences that occur. Even hypnagogic hallucinations that people have. And I don't know if you know what that is, but
I don't.
Those are, and we used to, have you ever heard it back in the day where people call it, I guess, the witch ride on your back when you wake up and you can't move and see things in the room that are not there, and you think you're talking and you're really not, or you might hear things, and that's because you're in that state between full sleep and full wakefulness. And a lot of times the things that you dream might appear in the room. So because your body goes through sleep paralysis, your body paralyzes itself while you're sleeping to keep you from acting out your dreams. And that's why, a lot of us don't sleepwalk or fight and things like that. And because our body goes into sleep paralysis.
So that reminds me of a question. There's nothing on the subject, but really it is. So what is going on when someone acts out, like physically? Like you see some people that be fighting in their dream, they moving, their body didn't paralyze.
Right.
Is it something that caused them not to paralyze, or what was it?
Well, I mean, some people have sleep disorders. Some people have night terrors. Some people have, and those are, mental illnesses too. Night terrors, sleep disorders. Some people sleepwalk, where their body, may not go into sleep paralysis like, people typically do. And of course, in even like the origins of these different disorders are still poorly understood, because like with schizophrenia, we still don't know how it starts. We have some idea, there may be some biological basis for it. It may be inherited traits. Some people are just genetically predisposed to developing these different disorders, because if your parents have, generalized anxiety disorder, or your sibling has it, then that increases your risk for developing that, or even your temperament. If you've always been like a timid person or a nervous person, that also can increase your risk for developing generalized anxiety disorder. And then of course, brain chemistry. And like, you and I had kind of talked a while back, Chuck, about different brain chemistry and neurotransmitter activity.
Right.
Where there are 6 major neurotransmitters in the brain. You have serotonin, dopamine, norepinephrine, acetylcholine, GABA, and glutamate. And so you have brain neurons, which are the brain nerves, and the brain activity moves through the brain neurons, as electrical activity. But see, brain neurons, they don't touch. And so in order to get that electrical information from this brain neuron to this, there are neurotransmitters that take that information across a microscopic area called a synapse. And so the neurotransmitters serotonin and dopamine, like I had just mentioned. And so they take that information from the end of this neuron to this neuron.
Yeah.
And so if there is like an overproduction or too much dopamine in the brain, then the person could develop schizophrenia. And if a person has an underproduction of dopamine in the brain, then the person could develop Parkinson's disease. And so that's the purpose of the medications, to help regulate the neurotransmitter activity or that chemical activity in the brain, so people won't have those different symptoms. In the same manner that if you had diabetes, you take medications to regulate your blood sugar. Right. Or if you have hypertension, you take medications to regulate your blood pressure, because with the neurotransmitter activity, the overproduction or underproduction, the brain isn't able to regulate it on its own anymore. And so you take the medications to help do that. Does that make sense?
Yeah. Two things real quick. Want to turn it over to our guests. Those in the comments. If they have a question, something that Dr. Smith has talked about that resonated with you, or if you want to ask a question or you make a comment, go ahead and do so as we get towards the end. We at 10 o'clock, so we're going over just a little bit.
Hey, it's all good. It's all good.
So drop that in the comments. And also, I don't know if this is in the DSM-5, but it's damn sure real. We talk about environmentally induced behavior, and how we become a product of our environment, or you know, depending on who you were raised by in the area, you pick up some behavior traits. Absolutely. Without having symptoms of what so those things. If you could kind of talk about that a little bit, and we'll just wait to see if anybody have any comments.
Yeah. So I was actually talking to a few clients about a year ago, maybe 2 years ago, and we were talking about negative thinking patterns, where a lot of times people they develop depressive symptoms because of the way they view themselves, and they view the world, and they view others. And so, I was doing some thought records, analyzing the person's thoughts. And I noticed that every time they had a negative thought, they would have all these negative thoughts, and that would lead them to have negative feelings such as depression, sadness, hopelessness, anger, envy, jealousy. All of those are negative emotions. And so I had told those clients, I said, I noticed that you had kind of got off into a negative thinking pattern, because, we had kind of already established the fact that humans were made up of both positive and negative attributes. But I said, it seems like you only focus on your negative attributes and never positive attributes. And if you're always thinking negatively, and if we've established the fact that negative thinking leads to negative feelings, which leads to negative behaviors,
right,
then you have to look at, the source of that negative thinking. And so so you look at negative thinking patterns. Negative thinking patterns emerge from how we were raised, what we were taught, the environment that we've been in, experiences that we've had, traumatic experiences, things that people have said to us in our formative years. If you were raised, if your parents or adults in the neighborhood told you on multiple occasions as a child that you would never amount to anything.
They ain't say that. They were gonna say you ain't shit.
Right.
You ain't gonna be shit. That's
right.
That
becomes a part of you.
Right.
And you end up as an adult being affected by a lot of that stuff that happened in your childhood. Those things come back and bite you. You know what I'm saying?
Heck yeah, man. I had a conversation with McRae, which is my oldest son, his 7U baseball team, about self-talk. And Mac, we talked about this on the show one night. I say, man, look, when y'all miss a ball, and I'm breaking it down to the way that I'm talking about mental health to my kids. I'm like, look, y'all can't dwell on and get down on yourself because y'all missed one ball. You got to watch how you talk to yourself.
Right.
And I tell him, like, in the morning, look, man, you gotta speak positivity to yourself.
Absolutely.
You gotta say, I'm going to have a great day. And, we pray on the way to school, and we meditate, and we talk about things that we want to have happen in our life.
Mm-hmm.
And I say, man, you got to do that same thing on the ball field. But imagine the number of people that have never heard of the phrase self-talk, or what you just described, Fred, is like you still carrying the phrase, or you ain't gonna be shit from your childhood into, and you've achieved some amount of success, and you still are carrying that type of phrase with you, thinking that you ain't gonna be shit. And you literally are a person that has defied the phrase that they were trying to describe you with.
Absolutely. Because you have you it's like wearing, I wear glasses, and it's like wearing rose-colored glasses.
Yeah.
You see everything the color of the glasses, even though that's not how the world really is. Everything in the world isn't red, but that's the way you see it, because these are the glasses that you're wearing.
Yeah.
Because of all of those things that people have said to you, growing up. So of course, your environment, definitely, Mac, your environment, how you were raised, things that were said to you, traumatic experiences, they affect how you view yourself and how you view the world, how you view your future, and how you view others.
Yeah. You got 2 questions out there, Dr. Smith.
Look, we got on the same note, Cliff said in his line of work, they say claim that shit. Whatever you want to achieve, you claim it. Now we got an actual question from Tricky. Tricky says, Dr. Smith, do you think that the shooting in Buffalo, New York will have a mental impact on the community going forward?
Absolutely.
You got one on us.
Trauma.
Right now.
That's a traumatic experience.
Yeah.
And a lot of those people that witnessed that increases their risk factor for developing post-traumatic stress disorder.
Right.
There are people that survived 9/11 that are still impacted by post-traumatic stress disorder. And that happened a little bit more than 20 years ago. And then also people experiencing survivor's guilt, where I got out,
right,
but my friend or my coworker perished.
Right.
And I'm guilty because I survived and they didn't.
Yeah.
And so of course, all of these mass shootings absolutely affect us, because when these things happen, we think that the world is a dangerous place. And it can be. It absolutely can be. But if you have this belief that the world is a dangerous place, then that's going to affect you to the point where you feel paranoid. You feel like people are always going to try to harm you. You're saying, okay, I can't be safe in my home because people might commit a home invasion. I can't be safe in church because people are going up shooting churches and synagogues.
Yeah.
Can't be safe when I go to school or when I go to college, because you have school shootings and you have shootings even on college campuses. Now I can't be safe when I go to the grocery store. If that makes sense.
Yeah.
So absolutely is going to definitely have an effect or impact on us. Definitely.
It is a major impact, because even so what you just said, now everyday people that have no history of emotional disturbance or mental health now have real life PTSD because of situations like this continue to happen, and they don't know if they're going to walk into a situation.
Absolutely.
And the average person don't understand, like, that person is not playing. They have a real live trauma because they don't know. When George Floyd was killed by those rat bastard terrorists, my daughter was afraid at 14 years old, and she was more afraid for me. And her comment was, I don't trust police because, one guy sat there on camera and killed another guy while the other people stood there and watched. You know what I'm saying? So folks
and they were begging him to get off George Floyd, and he wouldn't get off.
But I can't see social media and policies are so crazy now. Like, and go to Dr. Amos Wilson, where he always say the radical mind for the Negro, the rational mind for the Negro is considered to be radical. Any other culture automatically fights back when they feel threatened and attacked. Our culture, due to another trauma and traumatic situation of slavery, when it looks like other folks, we don't even think about it. You know what I'm saying? So we deal with a lot. Like right now, Chuck and I might have a different type of trauma from watching this situation. how a father with his children end up being shot by trying to show you his wallet when someone just executed several people and you can take him out without a scratch.
Mhm.
And this has been a pattern across domestic terrorism in this country, where a young white kid go around. So what they don't understand, and this is another traumatic situation and mentally affects us. You stereotype and profile young black that's selling drugs and say what that's going to do to other young black males if we don't throw the book at them. We got to send a message. But you let a little white boy leave his home state with a rifle and go kill other people.
Yep.
And you let him get away with it. So what message
Mhm.
did you just send to other folks that look like him? And you did not, you know what I'm saying? So it's like we are dealing with real live trauma.
Absolutely.
You
From
know,
a lot of different fronts.
Persistent,
Mhm.
persistent trauma.
persistent trauma that we see.
Yeah.
So when you have children, you really
persistent.
work.
Yeah.
Yeah. So talk about Fred, like, you know, help understand, like tell people, like, you know, to explain that's a real life situation, like, you know, having that type of trauma.
Yeah, absolutely. Because I even remember when I tried to watch the video of George Floyd, and I couldn't even watch it. It was just difficult for me to sit there and watch this man pretty much begging for his life, being in that type of agony. And I felt traumatized, vicarious trauma, just from watching that.
Right.
Mm-hmm.
Yeah. I can't do it. Like the videos. I mean, I get like visibly emotional.
Me too. Couldn't watch it
when I see it, and I noticed that. I was like, nah, I'm not gonna subject myself to this. And then, you know, via social media, via you know, evening news and all of that. Nah, I'm not gonna do that. Now, I'm not saying that I'm trying to be blinded or put on the blinders to it.
Yeah.
But in terms of, you know, preparation, you know, you have these conversations with, you know, your kids or, you know, young people that you work with. So Fred, on that same line, as we get ready to wrap it up, I would like for you to give, you know, some recommendations of just, you know, daily things that you can do to either check on yourself and check on your friends, or you know, some preparatory things that we can do or advocate for as it relates to mental health.
Well, one thing is just getting help early, because early intervention has better client outcomes. So getting help early, you know, getting psychoeducation, you know, reading about these different illnesses and trying to understand them and what they are and what they mean.
Yeah.
Avoiding unhealthy substance use. You know, not using, because a lot of times people that have, you know, mental health problems, they tend to use drugs to self-medicate.
Yes.
So you don't want to do that, but avoiding that type of usage, especially in this day where they're putting all type of things in different drugs, fentanyl, where they're putting fentanyl in different drugs, and then people are out there, you know, smoking marijuana and dying because of these different substances are putting in, you know, marijuana or formaldehyde, rat poison. You know, if rat poison is used to kill rats, then what do you think it's going to do to you?
Hey, buddy, you just broke it down right there.
Mm-hmm.
Come on, keep going.
You know, developing good coping skills. You know, people that have, you know, anxiety disorders and depressive disorders. You know, what are some things? You know, coping skills are things that help you manage or cope with the illness. You know, some people like to listen to music. Some people like to read. Some people like to go for, you know, long walks, go to the park. You know, also practicing good self-care. Good self-care is very important. You know, taking vacations regularly.
Yeah.
healthy eating, exercise, surrounding yourself with positive people, avoiding stress, as much as you can, because stress can a lot of these illnesses can stem from stress.
Yeah.
Post-traumatic stress disorder. So trying to eliminate as much stress in your life as you can. If that makes sense.
Yeah, man. That makes a whole lot of sense. And look, Fred, we appreciate you. And look, I want to give a shout out, and I'm gonna bring her back up. She hung in with us the entire time in the background. Markeisha Newsom, she's been back there, but she's back. I would like for her to one more time in advance next week, for her actual episode. Give the folks some of your comments as it relates to mental health.
Well, yes, absolutely. Great topic tonight. I just kind of wanted to piggyback on some things that we can proactively do to make sure that we're staying mentally fit. Exercising, getting some good cardio, that naturally stimulates endorphins. Those are those feel-good chemicals, right? That's going to reduce that anxiety and healthy coping mechanisms. So again, that goes hand in hand with your physical health, mental, spiritual, all of those things align from the top all the way to the bottom. So it's very, very important. And I think we need more of this, to debunk those stigmas, right? And just really empower ourselves, because knowledge is power. And when we know, when we make ourselves aware and we're confident about, making those educated statements and, not looking at people, crazy just because, they may have this diagnosis. I think that's important for us, and it's empowering as a culture, as a community. And lastly, so if you have not hit my link for Miss Health and Fitness 2022, please do so. I am currently also competing for the cover of Muscle and Fitness magazine. In a world where representation matters, I am asking for your support so that we can, break into the mainstream world of fitness and represent, because we are out here doing our thing, and it's time for the world to know. So I greatly appreciate you guys for having me, and I look forward to joining the panel discussion on next week.
Most definitely, ladies and gentlemen. Matt, you got anything you want to wrap us up with?
Oh man, I definitely want to thank Dr. Smith, Brother Fred, for doing a great job breaking it down. Sister, continue to fight to break down barriers. I get tired of seeing, I'm just gonna be honest, the muscle and fitness and everything else, and all the brothers and sisters we know that work out. We don't never see us on mainstream stuff. Fred, are you still? I know we talked about telehealth. I don't know if that's still available in certain areas, but how can folks get in contact with you? They want to, deal with you on private practice, consultations, or if they're in the Chicago or the Illinois area, and hey, they might have a group they want you to come back to Mississippi and speak to. Who knows? How can people get in contact with you and reach you?
Okay. Well, I'm on Facebook, of course. Yeah. And then I also have a web profile, because like I said, I'm currently a licensed clinical psychologist with LifeStance Health. And so, they can just type in my name and all the information will pop right up. I'm pretty much all over the web, with regard to the work that I do. So I do have a web profile as well.
That's it, man. That's it. Look, I don't think it's appropriate for us to drop where the money resides tonight.
Oh, yes. Yeah, it's always appropriate, because one of the main reasons we don't have what we need, we suffer from PTSD in the Black community because we are socioeconomically deprived, and we always got to get to where the money resides.
Damn it, boy. Hey, you did that. Hey, you did that, boy. You did that, man. Come on. Ladies and gentlemen, we'll see y'all next week. Tuesday, 9 p.m. Nightcap Knowledge. Put the kids to bed early. Get your nightcap. And we definitely want to give a special shout out to the official water of Nightcap Knowledge. That's Aspira Pura. Refreshing taste, keeping it simple. Available at Amazon.com. If you enjoyed tonight's episode, share this episode. Get in the comments again, and we appreciate you. We'll see you next week. We'll see you for Mississippi Greek Weekend, too. Holla. Peace.